Hello beautiful people, welcome back to the channel. I hope everyone is doing well. I hope you're having a fantastic day so far. So it's a brand new day, and for this video we are going to be focusing on Molina Health. I don't know if you guys have heard of this organization. Molina Health is a health insurance company, and they have two opportunities open that are fully remote. I have included an opportunity with Mayo Clinic, which I've done several videos on in the past, and also Inogen is another one that has multiple roles open right now as well. So we're going to just be talking about them. Before we do that, I want to take a moment to appreciate each and every one of you. Thank you for continuing to be here. Thank you for this platform, which allows me to do something that I'm very passionate about, which is helping people navigate the career world. So helping people find new opportunities, unique opportunities. So if you have any particular interest or any area that you are looking for opportunities and you want me to do the research, please come back, leave it in the comment section. Very interested in hearing and getting your feedback. With that being said, just remember to always have your notification bell turned on. It's very important. That is how you're notified real time whenever I post new job leads. Okay, so right now I do also want to encourage you to follow me in other social media platforms. I am on Instagram, the same Limitless Circle, also on TikTok, so please continue to follow in these platforms as well. I do post new content on there as well, so definitely go ahead and check those out. Now let's dive right into opportunities for today. The first one, as I mentioned, is Inogen. So Inogen is also a health company. It's a health company, and they have this opportunity open, which is a support specialist role. These roles, they have multiple of them. They have level 1, 2, and 3 open right now, and they're looking for people to come and fill these positions. What you're basically going to be doing, these are remote jobs, right? You see on here it is under clinical, but you do not need to be a clinician. This is a non-clinical role, and it's fully remote. So with this opportunity, you are going to be assisting in ensuring that different equipments that are placed in clients' homes meets patients' clinical needs. The primary focus for the support specialist is to support the local referral development manager, allowing the RODM to shift their focus away from delivery, setup of Inogen provided equipment. This could include delivery and setup of Inogen provided equipment, delivery and pickup of testing equipment, reports, documentation, participating in different sales activity. This is a part-time role, and candidate must live in the Thousand Oaks or Burbank, California area. So it does say remote. However, this position, particular one, they are looking for people that reside in the California area. So with this, you are going to be picking up, you're going to be delivering equipment. That's really the main piece of this. So it is remote, but however, you will need to pick up equipment and also help deliver equipment. So that's what this position is all about. With this role, because it is in California, the pay is actually on the high side, so definitely encourage you to explore. And if you're interested in providing assistance in helping people, encourage you to go ahead and explore. So you see on here for the level 1, right, that's high school diploma or GED or equivalent experience, 1 year experience of home medical equipment delivery. This is for non-clinicals. That is the support specialist level 1. Level 2 starts to get a little bit more clinical. They're looking for CNA individuals, people with CNA experience. And then level 3 is actually looking for either you're a registered nurse or a licensed respiratory therapist. So that is level 3. And level 3 tends to pay very much higher than level 1 and 2, and that makes sense because of the expertise. So I encourage you to go ahead, explore these opportunities. I know sometimes folks are interested in seeing patients, but just mainly on their own schedule. This will actually offer you that, and it's a part-time role. So if you are doing case management on a 9 to 5 and then you have this as a side gig, this is definitely a good one because it will allow you the opportunity to be able to set your hours and be able to, deliver when you are able to, and be able to see the patients and ensure that the equipment are working for them as it should. So that is the first opportunity. We're going to move on to the next one, which is now with Mayo Clinic. So Mayo Clinic is looking for a specialist, and this individual is going to focus on HIMSS, which is Health Information Management Systems. So you're going to be focusing on HIMSS. The goal is to make sure that the platform, health information platform, which is usually, Epic is an example. You have MaxMC, you have KeyCap, you have multiple of them, IQ, and so forth. These are just examples of a lot of platforms that allow, providers as well as patients to communicate. You also have something called MyChart, which is another one that is among a lot of bigger facilities. So they are looking for somebody who's going to focus primarily on the system, like focus on information within the system, how it's transferred from one place to another, how communication is happening within the system, how prescriptions are written, everything that has to do with the management of the care of patients within the system is going to be the bread and butter of this individual. Your focus is going to make sure that any type of new updates that are being made, that you are conversant in them. This individual is going to really be focusing on helping to connect the dots in terms of any gaps in documentation or data integrity and so forth. So you see here, this position is 100% remote. You can work anywhere from within the United States. They are not offering sponsorship at this time. And qualifications for this position, they are looking for you to have an associate's degree in healthcare, whether it's in applied health, behavioral health, when anything related, anything in the sciences or in healthcare is what they're looking for. So as long as you have an associate's degree, you can apply. They also talked about associate's degree in health information technology. That is actually preferred. So even if you have health information technology degree, it is preferred, but it's not required. So even if you don't have that, you can still apply. They are also talking about someone who is going to be able to complete the HIT associate degree is required within 6 months of hire for continued employment, must possess knowledge of medical records and so forth. So even though they have it as a preference, but they also require you to actually have a degree in HIT. So they are encouraging people that are already in health information technology. So even if you are in school, you're not done yet, as long as you know you're going to be done with your degree in 6 months, you can definitely still apply. I genuinely like this opportunity because it's an open opportunity for students that are still in school looking to potentially land a job very soon. This offers them that opportunity to get the job, and then once they're done with your degree, they can continue with their employment. And this also means that if they're expecting you to get hired to finish your degree in 6 months, there's also the possibility of some of your education getting paid for. So definitely one to consider. So I encourage people to explore this. It does talk about being able to utilize Microsoft products, Excel, Word, Outlook, etc. So definitely check those out. REAR is one that registered health information technician or registered health information administrator. Those are certifications that they prefer for this individual to have, and the salary for this position is between $17 and $26 per hour, and your schedule is going to be very typical, which is the 8:30 to 5 p.m. every day, 9:30 a.m. to 5 p.m., and they work off of Central Time. So definitely something to also think about. So there are no weekend schedule with this one, so it is just typical, again, 9 to 5 or 8:30 to 5. So that's the second role. The third role, which is now with Molina Healthcare. As I mentioned before, Molina Healthcare is a health insurance company, and they're looking for a specialist who's going to focus on quality interventions, someone who's going to focus on quality insurance in the area of compliance. This area is one that continues to expand. Everybody wants to follow the rules, and compliance allow you to do that. Regulatory specialist is another one. So the world of regulations is one that continue to expand as well. So they're very much in close proximity to one another in compliance as well as regulations. So basically your role is to ensure that all the rules that have been put in place are being followed, especially from quality standards perspective. Like NCQA is a regulatory body that focus on making sure that quality healthcare is being provided, whether in facilities, hospitals, etc. So this individual is really going to be focusing on key performance metrics, is going to be ensuring that all of the quality expectations, compliance expectations, making sure that they are actually being met, and when they are not, working with the different areas to bring about a resolution, bring about effects. With this particular role, they are looking for you to have a bachelor's degree or equivalent combination of education as well as work experience. Minimum of 3 years experience is what they're looking for in healthcare, but they do also want you to have some quality improvement type of skill or experience, and they're looking for that to be 1 year. So this position, you're going to be doing a lot of business writing, which makes sense. You're going to be doing a lot of reports. You're going to be doing a lot of documentation of what is going on, how to resolve them, what are ways to mitigate any type of risk that may be uncovered, and then also operational knowledge and experience with Excel as well as Visio. And that makes sense too, because that is what's going to genuinely help in communicating any type of finding that you discovered during review of processes and so forth. So preferred field, they're looking for clinical quality, public health, or healthcare. 1 year of experience in Medicare and Medicaid is a preference for them. They also have like a preferred license as well as certification on here as well, which is a certified professional in health quality. So that is one they have listed here. If you are a nurse or someone who's HIMSS compliance auditor. So I mentioned this before, that NCQA, so HIMSS fall under NCQA, and they focus on making sure that quality care is being provided to patients. And this position is going to pay between $19 and $42 per hour. And that makes sense why the range is so wide, because if you look at the preferred license and qualifications that they have listed here, so nurses are definitely going to be on the higher end of this bracket. So definitely go ahead and explore and check it out. So nurses are welcome. This is the second role that we have on this list where nurses are included. So if you're a nurse, definitely check out these opportunities. And then the last opportunity that I do have is also with Molina, and Molina is looking for care review processor. So care review processor, this is a remote job, as you can see on here, and your focus is really to make sure that any type of care review that is happening before it gets triaged to nurses or case managers, or in some cases medical directors who are doctors, this individual is going to do those initial screening to make sure that any type of questions, if they can be answered as a non-clinician, this individual is going to answer them. And if they do require clinical expertise, then this individual is going to triage those calls to the right clinician to handle the case and help answer any type of questions the patient or the member may have. With this position, as you can see on here, You do have a lot of perks that comes with this role. You're going to be doing a lot of clerical type of work. They are asking for high school diploma or GED, and then 1 to 3 years experience in an administrative support role. With this position, the salary is going to be between $12 and $26 per hour. That is the range, again, which is quite wide. So again, very dependent on what experience you bring to the table, geographic location, and so much more. So that is the last role for this video. I hope you find these leads helpful. Give this video a thumbs up, subscribe to this channel if you've not subscribed already. Till next time, I wish you guys all the very best of luck, and I will catch you in the next one. Take care, guys. Bye bye.